Hi, my name is Chanel and I'm going to be your student PTA for today. Can I confirm your name and your date of birth, please?
Glenn Williams, and date of birth is November 10th, 2009.
Okay, nice to meet you, Glenn. How are you today?
Good.
You're doing good. So, what brought you in today?
Back pain.
You have back pain? Okay. And how did you get here?
By car.
Oh, a car brought you here? Okay, great. Okay, the patient was able to answer my questions, so that's an indication that the patient's mental status is intact. So, Glenn, today I will be working with you and we will be doing a manual therapy that consists of a Petrissage massage. Have you ever had a massage before?
This is my first time.
Your first time? Well, there's a first time for everything, and I hope you like this massage today, okay? So, what this massage is going to do for you, this is going to be, it's going to be like more like of a kneading technique. It will help to like break up those adhesions that you have in your back. It's going to help to improve your mobility. It's going to improve circulation of your blood flow. And this is going to help to relieve the pain that you're also currently experiencing. So you will feel both of my hands um, coming in contact with your mid back, this area right here, because this is the area that you are experiencing the pain, correct?
Mm-hmm.
Okay. So you will feel my hands coming in contact with your mid back as I press and roll and like squeeze across that area to perform like that kneading motion. You shouldn't feel any like extreme pressure or discomfort, but if you feel like, it's too like intense, please feel to let me know and we can go ahead and we can reassess. So, like I mentioned, relieving those impairments that you are currently having right now, this is going to lead to you to be able to do the stuff that you do on a regular basis, like carrying your groceries, like getting stuff from out your cabinet, and also for you to do the stuff that you enjoy to do socially as well. Okay. So, do I have your consent to work with you today?
Yes.
Okay. So what the first thing I'm going to do before I go ahead and I perform the massage, I'm going to check your skin to make sure that everything is good in that area because we want to make sure that you don't have like any fever in that area, that your skin is intact as well before we go ahead and do anything on your skin, okay?
Mm.
So I'm also going to check your blood flow as well in that area just to make sure that you do have adequate blood flow. So I'm visually looking at your skin and everything looks okay in that area. So I'm going to go ahead and I'm just going to check the temperature in that area just to make sure that everything is in that area is good as well. Okay, I'm going to check a little bit away from that area just to make sure that your temperature is good throughout your mid back, throughout your back. Okay, so also your temperature was fine. Everything looks good by visually looking at it. I'll go ahead and do this stuff called capillary refill. I'll hold for 3 seconds and then I'll let go just to make sure that the blood flow in that area is adequate as well, okay? Okay, so great. So everything seems good in that area. So what I'm now going to do is to go ahead and perform the massage that I have for you today. So I'm going to put a little bit of cream on my hand, not too much, just a little bit. And I'm going to go ahead and where are you currently experiencing the pain? Is it more on your left side or more on your right side?
Am I right?
Your right side. Okay, so I'm going to go ahead and I'm going to perform this massage. It's going to be for a duration of 10 to 15 minutes, okay? So I'm going to go ahead and do a kneading technique. This is called Petrissage. How does that feel?
Good.
Feels good? Okay, so I can either do kneading with one hand or I can do like alternating kneading where I switch my hands. How are you doing?
Good.
Doing good? And I would do this for 10 to 15 minutes. Check on the patient periodically, see how the patient is doing. How are you doing?
Good.
Doing good? Okay, great. Okay, so it has been 15 minutes. The massage is complete. I'll now check on the patient. How are you doing?
Great.
Doing great? Okay, so today I worked with you and I performed a massage called a Petrissage massage. This massage is gonna help to relieve the pain that you're currently experiencing. And from a scale from 1 to 10, how is your pain compared to when you first got here?
10.
Like from a scale to 1 to 10, 10 being the most, 1 being like a little bit of pain, 0 no pain at all. So what would you rate your pain scale right now?
Mm, like 2.
A 2. Okay, that's great. So were you a 10 when you first came in, or what would you say you were when you first came in?
Like an 8.
An 8. Okay, well, that's good to know that we did get to relieve some of that pain that you're currently experiencing. And now we can move on to the interventions that we have planned for to you today, which is a little stretching and a little bit range of motion to help to also increase that mobility for you, okay?
Mm-hmm.
Okay, thank you and have yourself a wonderful day.